our president of the Conference of Heads of Assisted Secondary Schools, Alhaji Yakub Abukari, who is joining me via Zoom. Sir, thank you very much for your time this afternoon. Good afternoon.
For having me.
Let's start with how many schools you have noticed from your checks that do not have the PPEs as promised by government.
Thank you very much. As far as CHASS is concerned, we are in link with all the schools in the country. And we have a platform at regional level and national level where we receive information on issues like this. So far, we haven't received information from our regional chairs that indicates that some schools have not received the PPEs. What rather happened was that some schools received their shortage of the numbers they were expecting. And they have made this known to the respective regional directors of education. Taking Ashanti region, for example, as we speak, the regional director of education has received new consignment of these PPEs and has informed all headmasters in Ashanti region that if you are a school and you didn't get the full complement of your PPEs, do well to contact her office so that the shortfall is given to you. And I hope the same applies to other regions in the country. So as far as CHASS is concerned, we are not aware of any school in the country that has not received its PPEs. Maybe they received it in short, and the additional ones have, as I speak to you, been sent to the regions to be given to them so that it will make up the shortfalls.
Isn't it worrying to you that we were told that everything has been planned, there is not going to be any delays, etc., and it looked like we really sincerely had everything under control? Doesn't it bother you that after all of that, some of the schools still have what you're describing as a shortage whilst you wait to get the response from your officers on the ground?
Yes, that is very true, that it is quite worrying, because ideally we should get everything beforehand so that we can plan and execute our things very well. But unfortunately, you are dealing with human institutions, and sometimes some of these things happen which are beyond your control. So we have understood it that with the few that we were given, that is 2 each to staff and students, and all the others, the Veronica buckets, the sanitizers, the tissue papers, and what have you that were given, we were told to manage with that so that the remaining ones that were not enough will be brought later. And as I told you, Ashanti region, we have received ours. So it is not the best situation that we've not received the full complement of what we were expecting at the beginning. But we understand that it could be one of the shortfalls of the human beings. And since we have started receiving them now, we think it's okay, we can manage with the situation.
Alhaji, let me ask you about the management protocols that the schools have been told to use. I mean, what is a protocol? What is the laid down rules and regulations? What are you supposed to do if you're a teacher, somebody shows symptoms, or a student reports, you know, something? What is the protocol? Can you help us follow?
Yes, thank you very much. The protocols are that currently in almost all the schools, I'm using almost all because we are expected, but we are hearing there are some few schools that it hasn't taken place yet. We are expected to constitute a COVID-19 team. And this COVID-19 team have been briefed on how to go about issues should a suspected case come up. All our schools have also been mapped to health facilities closer to our schools. The intention or idea behind it is that should any case come up that is suspected, we quickly get in touch with these health facilities so that they will come to the school, examine the situation, and if they need to carry the student to their outfit for further examination, they do that. In our schools also, we've been given health nurses who are currently in the various schools assisting us with health issues. So when the students report of not being well, these nurses are able to examine them, and if per their examination they feel that the students need further examination because the symptoms indicate that they are signs of COVID-19, they refer such students to be taken to the health facilities that we've been attached to, or the authorities from health facility come to the school to examine the students further. And where it is observed and suspected strongly that it is so, they take the student to such facilities and then continue with whatever treatment or attention that the students deserve. These are the protocols that we observe at our school level. So therefore, the COVID-19 teams that are in our school, they make sure that sensitization of students go on every now and then. We have prepared posters and put them across the school. During dining hall, we try to educate them the more before their meals and sometimes after the meals.
Okay.
And we've also told our teachers, when they are in the classrooms, before they even start their lessons, they take the first 5 minutes or thereabout just to talk to the students and let them know the seriousness of the situation and how everybody should be very careful and go by the protocols.
Okay, so
at the school level, we make sure that these students wear the nose masks. The same applies to our teachers and non-teaching staff. They also wear the nose masks, and then we keep the social distance. These are all part of the protocols of the COVID-19, which we observe at the school level.
Okay. Having said that, you indicated that you are speaking from the Ashanti region. So I'd like for you to, now that you've listed for us this protocol, comment on what happened at the KNUST SHS.
Thank you very much. To begin with, let me say it was most unfortunate, the incident at KNUST SHS. If indeed the protocol had been followed, to a large extent, these unfortunate happenings wouldn't have taken place.
So you're convinced that the protocols were not followed? Yes,
of course, because when the child was not well and was brought to the attention of school administration, first and foremost, call was placed to the health facility and the response was delayed. And the parent of the child who was called to come to the school, I felt ideally, since there were some delays, nothing stopped the school from organizing official vehicle from the school and conveying the child to the health facility that the school was mapped to, so that the child would have received early attention and the unfortunate thing could have been averted.
And right now we're told that some, where are we with the investigations that are being conducted on the back of this unfortunate story?
The body to investigate has been constituted, and it is tomorrow that it will be inaugurated. Then they begin with their investigation process, to the best of my knowledge.
So who is on this investigative committee?
I do not vividly know the individual that constitutes it, but I'm very much aware that CHASS has a representation on the committee.
So who is representing CHASS on this committee? Yourself?
It's not me, it is the Deputy Ashanti Regional CHASS Chairman.
Okay.
In the person of lawyer Dr. Ba.
Okay.
He's a headmaster of one of our schools in Ashanti region here.
Okay, and the committee will be inaugurated, you say, tomorrow for them to begin the investigations.
Very well.
In the meantime, what is happening on the campus? Do you know?
For now, there is calm and peace on campus. Teaching and learning is going on. The students have been spoken to and they are calm. And virtually, life is moving smoothly on campus there. Of course, we cannot rule out the fact that there is some level of fear and anxiety as a result of what has happened.
Yeah, by all means. But let me bring your attention to, you spoke about all these protocols. I bring your attention to what the National Council of Parent Teachers Association is saying. They are asking for government to send the children or send the students back home. And they don't just say this. They make the argument that they've noted that some of the schools have not received PPEs the schools which have received did not get the full supply. The COVID-19 protocols, especially social distancing and wearing of nose masks, are not being adhered to by these students, and that there aren't enough health personnel who are supposed to be stationed in the schools. They are looking at all of these, and they say that more worrying is the fact that despite good counsel and encouragement, most parents insist that their children should be brought home. And following all of this, they are asking that the schools, the government should allow their children to go back home. What is CHASS's position on this? Well,
CHASS's position on this is that I think authorities, and when I say authorities here, I'm referring to GS managers, Ministry of Education, and maybe the government, will study the situation and take the appropriate measures. But looking at the situation as we have it now, we are able to manage the students to the best of our abilities within the environs of our schools. Should parents insist that the children should be sent home now, what states are the children in that they are going home? Are we 100% sure that all of them are COVID-19 free, and for that matter, they are going home?
Is this
or
a matter
some of them
testing?
Have the virus and they are going back to their homes to maybe infect others with it.
But that will be a matter of testing, isn't it? Testing and letting them go back should work, wouldn't it work?
So in other words, therefore, before they talk of children going home, they should ensure that testing has taken place on all students in their respective schools. And when we are sure that nobody has anything like that, and the issue of going home is going to be considered, then that is done. But to stand at the blue and just say all children must be allowed to go home, I don't think that will solve the problem. It may compound it rather.
The PTA also indicates that the children, we send them back there to prepare for WASI and BEC. They say that they are psychologically unstable at this moment. I'm getting from what you're saying that CHASS is okay if we can test these students, and if they're positive, negative, we can let them go back home. That's okay with CHASS.
From the grounds, we don't see any serious psychological problem with the students such that they cannot continue with their learning. In fact, the children or the students are anxious and they are going about their study, preparing for their examination. And we are sure the children would prefer that as again being asked to go home and the examination postponed or whatever.
There are a number of countries that have decided that they're not doing this anymore. They've pulled out of the WASI, for example. Kenya, we know, has done that. I mean, there's Nigeria, to be specific, for West Africa, which has also pulled out. Why does Ghana think that we can deal with this when there are examples around us that probably we can't?
Thank you very much. From the beginning, Ghana had decided alone to go about it as a Ghana examination. Then later, since Ghana is always a pace setter, Nigeria, Sierra Leone, Liberia, the Gambia agreed to also join us. So if at some point they have assessed their situation and they feel they cannot continue and have pulled out, we are not using Nigeria, I think, as a yardstick to determine what we should do. If we as a country have already decided on it earlier, even before Nigeria decided to join us, and at some point they think they cannot handle their situation and so they are withdrawing, that should not be a yardstick for us to also say because Nigeria is withdrawing, we should also do the same. We should rather allow Ghana to do its own assessment, and like I rightly said, if education authorities with government come to the conclusion that we cannot go any further and so we should put a stop there, well and good. But we shouldn't use, to the best of my understanding, a different country standards to access ourselves.
Now, I'm just interested in CHASS's position, and that's because CHASS is a key stakeholder. And so if CHASS, that's working on the ground, can assess the situation and say, and advise the policymakers and decision takers and say, this is not okay, then perhaps we'll be heading somewhere. This is why we bring it to you as CHASS.
Thank you very much. So at this stage, per our assessment, we think we can manage the situation and move on.
Okay.
And let the children write the examination, God willing, when the time comes. But moving forward, should situations become worse, then that is a different scenario altogether. But if it is what we have on our hands now, we think it is manageable.
About 10 schools, we understand, have recorded cases. That's manageable?
Yes, against over 700 senior high schools in the country.
Very well. This afternoon, the opposition NDC has, they organized a press conference. At that press conference, they say that we're putting the lives of these students in danger, and they are urging parents to withdraw their children from school. What's your reaction to that?
Well, you know, we don't go to the political side of it because that is left with the politicians to do their argument. You've asked me what is CHASS's own assessment of the situation. And I've told you that as far as CHASS is concerned, we think as of now, the situation is manageable. So we can move on and let classes go on with the children so that they eventually write their examination. But as to what any political party has said, that one we don't go into those areas, please.
But essentially, from what you're saying, you don't agree with the position that withdraw the children from school, which is what the NDC is saying.
No, you are saying that. I'm saying that
I'm just asking a question.
It's a manageable situation for us for now. I'm not saying we do not agree with any other person, please.
I mean, I get what you mean, and I get that you really have to veer off, you know, meddling into politics. But essentially, that's what it is, and I'm grateful that you answered that question for me. So, at this moment, it is manageable. That's CHASS's position. You say that the children are. You don't have any evidence to show that the children are psychologically unstable to be able to write the exams. Have you been in touch with the PTA, the council? National Council of PTA?
As of now, the council has not contacted me yet.
Okay.
But we are in touch with our respective school PTAs, and we are working in conjunction with them to ensure that the school runs smoothly.
Okay. Well, I'll say a very big thanks to you. I'll say a very big thanks to you for your time this afternoon. And I hope that we're able to manage this sincerely, devoid of the politics, devoid of the journalism and everything. I sincerely hope that we'll be able to handle this properly. Thank you. I've been talking to the president of the Conference of Assistant Heads of Secondary School, Alhaji Yakub Abubakar.